And let me tell you what Obamacare states very clearly. Home visiting programs are a part of this law. That means they want to come into your home to see what you're doing, and they cannot stand the independent thinkers like homeschoolers or private schoolers. Think of how the government must come into every home now, homeschool, private school, first gather information and use this data to basically intrude your parental rights. It's there. You cannot resist. Now in Oklahoma, we have some really good homeschool laws. Basically, a government agent can't come there without permission. They can't come in and surveil you. But with Obamacare, it's all gone. The idea of school readiness and academic achievements provides the excuse for government agents to nullify parental prerogatives for private school type of programs and the government agencies, and basically nullify parental prerogatives for private homeschooling and homeschooling. You know, they're going to even test your children to see if they are meeting the standards. My wife is not much of a confrontationalist, but when I told her about this, and she'd homeschooled primarily 3 wonderful children that we've raised. One of them is in law school, has an MBA, and another one is a master's in biology and is in medical school, 3rd year, and another one that's has a bachelor's in criminal justice and Homeland Security and works for our local police department. Broken Arrow is about 100,000 population, and they're all very happy, very productive members of society, and no one can believe that they were homeschooled. But as we see that the government cannot stand this, independent thinkers, people that are successful, that don't follow the cookie cutter mold of government schools and institutions, and I can tell you that the federal government has never been a friend of homeschooling. While the law does not specifically state that preschool children will be tested, it is impossible to implement the mandates without testing. As we see further on in this legislation and this report, the corrective action established legislation, a group to begin the process. It's known as the Interagency Working Group on Health Care Quality. It is composed of a mind-numbing array of government agencies, many of which are sure that you don't even think exist, but they're there. By listing them, you will begin to see the intrusive nature of government into medicine, even before this law is passed. The working group is mandated to include these departments. Departments of Health and Human Services and Centers for Medicare and Medicaid and on and on and on. Even groups that are Department of Commerce, the Office of Management and Budget, Office of the United States Coast Guard. What does that have to do with health care? Again, it's a grab, a total grab of your freedom, and intrusive government agencies that want to mandate Federal Bureau of Prisons, the Highway Traffic Administration, Safety Council. As you look at the list of these government agencies in this working group, ask yourself what kind of a politician wants the sort of government intrusion into medicine and your family, and more importantly, what do they intend to do with it? The scary part of the new law is it'll be placed under the Department of Homeland Security. Now, what does that tell you? Well, they need enforcement powers. The Department of Homeland Security, which oversees many other departments interlinked with the domestic policy, the Secretary of Agriculture, Federal Trade, the Secretary of Transportation, on and on, these other agencies, Department of Interior, Bureau of Indian Affairs. You know, my mother was Native American, and she told me a story one time. You all know who George Armstrong Custer was, don't you? General Custer went to the Battle of the Bighorn, and he was the first director of the Department of Bureau of Indian Affairs, the BIA. And when General Custer went to the Battle of the Little Bighorn up in the Dakotas, he told the BIA, he says, don't do anything until I get back, and they haven't. My mother's favorite joke. Yeah, as you look at this list of government agencies in this working group, ask yourself again, What are we going to do under the Department of Homeland Security that's going to have health care? Other groups in this law mandates to be established to implement their recommendations include many of the aforementioned agencies and also these listed. Why is Homeland Security and agriculture and others being involved? You can quickly see, again, as the cloud starts to clear on this terrible bill, this law that's on us now, you can quickly see, begin to forget that the law was sold to us as a health care package reform when you see all the government agencies that are come together tell us what is best for us and our children. You know, I hate to say it, ladies and gentlemen, but Obamacare is more than a control mechanism. It's more of a socialist government than a health care law. Now you begin to see why these 20th century dictators loved and used socialized medicine to control the people. Is Obamacare trying to establish a socialized state? We have the answers. We leave it to you. I think he does. It's very evident what they're headed towards. Whether he is or not, who's going to go after him? Will the Congress, Republicans, or Democrats? I wouldn't count it. The history of the constitutional government of protecting our rights is pretty minuscule at the federal level. So we as the states must be concerned about this. We're a bit concerned when a communist dictator like Fidel Castro congratulates Obama on the passage of health care. He says, "We consider health care reform to have been an important battle and success of Obama's government." Fidel himself. For students of history, this praise should come as no surprise, because the man most responsible for modern communism besides Karl Marx is Vladimir Lenin. It's widely quoted. Socialized medicine, the keystone, the arch of social state. I start a lot of my lectures. I lecture all over the country for the Tea Party and the Birch Society and other groups that will listen. And I always started off that in 1917, Lenin said, at the apex of the triangle, until you control the apex, which is socialized medicine, you cannot control society. You can control the base, agriculture, education, government, commerce, transportation, but not until you lock up the apex can you control it. Hillary tried it in '93. Thank God the Birch Society and Association of American Physicians exposed it. They went around at the back door with Obamacare, and they bribed a lot of groups. AARP, the Hospital Association, the AMA, the pharmaceutical industry and Big Pharma. They bribed a lot of groups to get it, and again, as I said, it only passed by 5 votes in Congress. We know that this is very hard for the average American to really believe what is happening, but there's another clue in fact that Obama is working with another friend who was forced to leave the administration for her views. Have you all ever heard of this lady or person? I don't know whatever she is. She was a director of communications for the White House and was caught on video saying that she looked to listen to this, she looked to Mao Zedong as her great philosopher. Nita Dunn. This was on video that they caught her saying this. Mao Zedong, of course, was the communist dictator that killed millions of Christians in communist China in his rule over his people. According to the New York Times, Anita Dunn is now working with the administration on a $25 million campaign to convince the American people that we need health care in this particular law. Some people told me earlier that, I believe it was Burley was telling me, that we are now being phone surveyed about certain things, and they want to come into our homes and ask us, why do we have any problems with Obamacare? $25 million of your tax dollars being used by this lady. The people who are appointed to fill these positions and implement Obamacare reveal more than the language of this law. They will be the ones implementing the law, and we have shown you already 2 appointments to indicate the direction the government is going. Let me show you another one now. You all ever heard of Dr. Donald Berwick? He's a physician. He is best friend of Obama. He was appointed to be the new administrator of the Centers for Medicare and Medicaid. Dr. Berwick's appointment was bypassed by the Congress. Just a few congressmen even tried to object to it. Ron Paul, Dr. Tom Coburn, Senator Coburn from Oklahoma. Just a few, even raised a small flap about the current makeup that's in our present Congress. He was appointed with the backdoor method. Dr. Berwick is a proponent. Listen to this. He's a government-enforced rationing of medical care services. He's a physician that wants to ration especially the elderly. This makes the appointment to the administrator of Medicaid very, very disturbing. In a speech in England, he stated that any health care system must redistribute wealth from the richer among us to the poor and less fortunate. Excellent health care is by definition redistributional. He emphasized the word must twice in his speech in England. In the end, Obamacare will serve as the platform for socialized medicine, for as Marx said, it will call for further inroads on the old social order. And this is the reason some people want Obamacare, not because they have compassion for the American people. It is a facade behind which many in Washington want to control us, the people. Now let us define health care. Health care includes the idea of medical care, but goes much further. Excuse me just a second. You can read that. Health care means the general condition of the body and mind. So they're saying it necessarily includes all aspects that bear on the general condition, such as the environment, nutrition habits, etc. It can be interpreted to transcend all aspects of life and living. It is not strictly medical. This makes the appointment of the next person, John Holdren, as Obama's sciences are. And what he advocated was really disturbing. He's advocated surrendering the sovereignty of the United States to a planetary regime like the UN or the World Court, World Trade Organization. He wants to use military power to enforce population limits by mass sterilization. We have seen that Obamacare includes life-limiting aspects such as euthanasia, as an appointee who advocates rationing of medical care, and now a man who wants to stop even life itself by mass sterilization. When Mr. Holdren says, will this become a part of Obamacare in the name of health care? This is not much of a stretch of an imagination. I don't think so. I think that this definitely is in the works and their ideas and their thought patterns. There are many people over the last century that have advocated mass sterilizations or experiments. They forced some of my mother's family to walk from North Carolina to Oklahoma. 9,000 people on the trail of Challaghee in Cherokee, the Trail of Tears, perished on that walk. They've experimented on black people in a Tuskegee in giving them or allowing them to have syphilis and see what happens to die. So this is not above government